Thank you, Mayor and distinguished members of the council. So Mr. Ramos was unable to be here this afternoon. He sends his regards, but thank you for allowing us to speak on a very important topic. I believe Mayor Miyagishima and Mr. Ramos were in communication regarding a request to try to give notice to our community about the challenges that we are facing as a public school system in regards to the use of cannabis. So I
was just going to say, even though I called you up, can you state your name for the record and your position within the schools?
Absolutely, yes. So Dr. Roberto Lozano, and I'm an associate superintendent. And then here with me too is my colleague, Amy Himmelwright, who is our executive director of behavioral health. So we'll both be speaking on the topic. So again, Mayor, thank you for the invitation. Wanted to just give you a quick update on providing with some data regarding the use of cannabis at our schools. So as you know, April 1st of 2022 was the first day that cannabis was legal as a recreational drug here in New Mexico. Right now it's premature of us to really say, yes, it's had a big impact, or no, it hasn't in our schools. What we can tell you is that we've had students who unfortunately resort to illicit drugs to address some of the mental health issues that they may have at home or whatever they may be facing at school. So really our focus as a school system is to identify those barriers that they may have where students resort to things like illicit drugs. So as a reminder, right, our students are not allowed to go into any dispensary to legally purchase cannabis. However, we do see our students having vapes. That is a huge problem that we're encountering, and that was even before the legalization of cannabis. Unfortunately, we have seen an uptick after COVID. After we were 100% remote, our data is showing us that cannabis is a huge issue. The number one substance that we find within our vaping devices is nicotine. However, there are times where unfortunately we do see whether it be cannabis, spice, other drugs that really are harming our students. With that, I want to allow my colleague Amy to speak to you about some of the mitigation strategies that we've implemented and continue to do. I also wanted to thank our SROs at the schools for really assisting us in addressing the need, because it is challenging. And like I said, one of the biggest goals that we have is to really get at the root of why our students resorting to substance abuse, when we all know research tells us that it's the root of something else happening at home. So really try to get them the support that they need. With that, I'll turn it over to Amy.
Good afternoon, Mayor and Council members. My name is Amy Himmelwright, Director of Academic Counseling and Behavioral Health for Las Cruces Public Schools. And so as the leader of our behavioral health teams in the schools, our role is really threefold when it comes to substance misuse. Identifying the risk factors and trying to mitigate those goes right along with efforts at prevention. And then, of course, intervention is necessary. And Dr. Lozano didn't talk about this, but and I just want to reiterate, so while we haven't seen a steep increase in discipline reports or incident reports of cannabis use at school, we have seen a tremendous, frighteningly steep increase in vape in general, which is why Dr. Lozano emphasized that it's not just cannabis we're finding in the vapes. I talked to a principal this morning at a comprehensive high school, and he said it's about 3-to-1 nicotine to cannabis in the vapes. So I want to bring to your attention that vaping in general is a big concern for us for a lot of reasons: health, safety, educational distraction, all of those things. So as we look at that, whether it's nicotine, alcohol, cannabis, whatever it is, we know that adolescents are at increased use for substance abuse when they're feeling rejected by their peers, when they develop hostile or controlling social goals, which can lead to peer rejection, when they engage in bullying behavior, which is interesting, right? Because you would think I might say when they're bullied, but actually engaging in bullying behavior is a huge risk factor for substance misuse. When they align with peers who use substances, and when they overestimate how many of their peers use or approve of substance use. So when I think about that, I think about Joe Camel and all of the ads in the 90s when I was in high school, and how when I was in high school it was considered very cool to smoke, like the cool kids did it. And unfortunately, I think part of the culture of youth right now is not even necessarily that vape is cool, but that it's not dangerous. It's safe. And so one of our tasks really as a whole community is to shift that thinking around vaping, cannabis and other products. And I also want to add, because I know we're here to talk about cannabis, we're seeing very little of the plant itself in the schools. That's why I keep going back to vaping. It's all, you know, it's, I would venture to say over 90% of what we're seeing is through vape. So, also, I can add that because there's this question, right, of where are the kids getting the vape, or is it illicit, most of the vape pens that are confiscated actually have that New Mexico stamp on them if they have THC in them. So when you buy cannabis products at the dispensary, they're stamped, Colorado, New Mexico, California, you know where they came from. So it's not like we're finding these handmade or rigged devices predominantly the ones the kids are getting their hands on were purchased at local dispensaries. So of course that begs the question for us then of how kids are accessing them. And I guess before we stand for questions, I'll just add then that our kind of plea to the community and the adults in the community, the same as we ask you to safeguard your prescription drugs, the same as we ask you to safeguard your firearms for child safety, safeguard your recreational cannabis. Like, don't let it get into the hands of our youth. I could go on for hours about all of this, so I'm going to pause there and just stand for questions. If you do that here, sorry.
Well, you were advertised on the agenda, so that allows council to ask you questions. Okay. We can't formulate any policy, but is there any questions council may have? Councilor Karan, Bencomo, Gandra?
First.
Yes, yeah.
Thank you so much for presenting and sharing today. I was lucky last week to just this work that is messaging around locking it up. They even gave me a little lock case that I took home, even though I don't have anything to put in it. But I think that they definitely are looking to help support, and I think they just did something right in Lea County that was really successful with students in particular related to sort of encountering their families' potential problematic substances, and so I hope that you might be able to connect to them. And they were just last week, they were bending my ear saying, please let us get in to talk to the schools. So I hope that connection can be made and support you in sort of creating that narrative. So thank you for being here today.
Thank you. Councilor Bencomo and then Mayor Pro Tem.
Thanks, Mayor. I don't have any questions. I just wanted to thank both of you, Dr. Lozano and Amy. I'm sorry if I didn't catch your last name.
Himmelwright.
Himmelwright. Yes. Thank you both for coming here. I really just wanted to appreciate that you sort of took a bigger, broader approach to the way you presented to us today and the way you're talking about it in terms of what's at the root cause. And often we've talked about trauma being that open door, right, to seeking more dangerous behaviors. And so I appreciated the behavioral health take that you have on this, and whatever we can do to work with the schools and with cannabis advocates. I know many are here today for how we talk about safe storage, especially, and then, we often have conversations about the black market. And so I think it's really important that you came here today and said, look, this is what we're seeing, because often that's what we're missing. And so, as opposed to just the noise, right? And so I just really wanted to appreciate the way that you presented here today. Thank you both.
Thank you. Mayor Pro Tem.
Thank you, Mayor. Thank you, Amy and Dr. Lozano, for being here. I also appreciate the way you've elevated this. I know there's some serious things happening, and looking at the root causes are so important to me. I had just a question about how you're recognizing in the vape pens the use of cannabis. I'm thinking, and I've seen over time is the use of synthetic marijuana and spice. And so are the youth self-reporting, or how are you identifying that it's cannabis specifically?
Okay. Thank you, Mayor Pro Tem. I checked in with my school principals right before this meeting, and what they're reporting to me is that the vast majority of devices that they're confiscating are labeled. So they're labeled with where it came from, what's in it, and that it was New Mexico certified.
Gotcha.
In addition to that, there are cases where a student may have engaged in vaping behavior and we don't know what the substance was, and we may have concern. So our school resource officers have access to test strips that they can actually test the liquid in the cartridge and find out what was in it.
And as they're testing that, they're reporting back to you all, but do they report it to another entity like the Department of Health or the group that controls the cannabis industry?
That's a good question. I don't know.
Okay. And how is, I guess, to Chief Dominguez, if that's happening, how do we know that, what are the numbers there? I think those are statistics that are important that we have.
Mayor Pro Tem, I don't have those numbers with me, but I can get them for you.
Okay, you have them though.
We can get them for you.
Perfect. Thank you, Chief. I appreciate that. And then lastly, I'll say, as you know, we have a health policy review committee. Both Counselor Flores and Counselor Cran sit on that health policy review committee. And Mayor, I'm asking that maybe this is an agenda item that we have specific to that, so that we're a part of the solution and strategies to mitigate this. I think this is important, and I know that it's important to the counselors here, and that would be what my recommendation would be moving forward. Thank you, Mayor.
Okay, well, thank you very much for that presentation.